Hello and welcome to Dr. Speak. Glaucoma is the third leading cause of blindness in India. An estimated 40 million people aged over 40 years either have glaucoma or are at a risk of developing the disease. I'm Dr. Rashmi Kotian, and on occasion of World Sight Day, we are talking with the leading ophthalmologist, Dr.BK Nayak, to gain insights on glaucoma, also called the silent thief of sight. Welcome to Dr. Speak, and it is a pleasure to have you with us here today, Dr. Nayak.
Thank you.
So what are the treatment options for patients suffering from glaucoma?
Yes, now the basic question is, if the glaucoma has been detected, then what are the treatment options? One thing you should realize the difference now. It cannot be cured. It can be only controlled, just like diabetes, blood pressure, because if you take medicine today, it will be under control today. If you don't take tomorrow, it will not be, it will be out of control. So the first basic principle is that it needs lifelong treatment, because the patient, we advise patient medication. Whether patient is taking at home or not, we don't know. And some patients are so clever, maybe they are clever in sense, but ultimately they are cheating themselves, that they don't use medication. When they are coming to doctor, 2 days before they start using medication. And then we see, oh, your pressure is well controlled, so it's fantastic, we'll continue the same medication, but patient is actually not using. So there are 3 types of options which are there with treatment for glaucoma: medication, laser treatment, and surgical options. But remember, for all, it's better that different medication, different mode of treatment may suit better for a particular type of patient. It depends what stage of glaucoma the patient is having, whether the patient's response to the medication is there or not. So based on many factors, we take a call. But surgery, usually these days, we don't do surgery at the early stage. If the medication is not sufficient enough, if the medical treatment is not tolerant by the patient, or there are side effects which again patient is very uncomfortable, so then we opt for surgery.
Are there any lifestyle changes required to be made for a patient with glaucoma?
Definitely, it needs a lifestyle change, in the sense that patients, if on medical treatment, then every day patient has to use medication. Sometimes it has gone up to 7-8 installations per day. So he has to really take care, and that's why these days there are a lot of apps which are being developed, just to remind the patient that now your time for your next eye drop. So because this is not simple, it's really very difficult. And also remember, these patients are most of the patients are advanced age patient, and that is, they must be having some other comorbidity. So with that, they must be taking some other medication. So it's a big lifestyle change. The second which probably also concern me, because if you are wearing a tie, then make sure you don't wear a tight collar, because if it's a tight collar, then it compresses the vein and there is a back pressure, which raises again intraocular pressure. People are getting attracted towards yoga. So if you are doing especially yoga like Sirsasana or Sarvangasana, where you are upside down and for some time, in that situation again the pressure in the eye it's raised, and which is not only one day, every day it is having. So cumulative effect does affect your glaucoma. So these things you should take care. If you are drinking also, then don't drink too much. So those points you must take care.
It was quite interesting to know about so many facts about glaucoma. So do you want to give any final message to your patient?
I just want to give 2 messages to the patient. Not patient, means the general population as such, that since, again I am repeating, since it's asymptomatic, so all those who are at high risk and after the age of 40, regularly go to the eye doctor and get your eye checkup done. And if the doctor is in hurry, please insist that have you checked for my glaucoma, number 1. And number 2, that if you have been diagnosed as having glaucoma, then don't get worried, don't get nervous, and don't get tensed, and always it can be controlled if you follow the advice properly. So this is my advice. And with the glaucoma also you can have a normal life. So don't think that glaucoma means you are doomed. So this is my second message.
Thank you, Dr. Nayak, for the expert insights. It was wonderful to have you on the show here.
Thank you very much. It was my pleasure. And I'm really thankful that you called me over here for this information, and I'm delighted about it. Thank you once again.
Thank you for watching this video on glaucoma. Subscribe to Speak Health on YouTube and Facebook. Stay tuned.